In this tutorial, we'll discuss about the antifungal or antifungi medication. So in order to understand this lecture in a very easy way, I will tell you people first of all the structure of the fungi, and this structure will be explained with respect to pharmacological targets. Means we will not go in the depth of the structure, we will just explain those points in the structure which will help us to understand the pharmacology, means which will help us to understand the site of actions of these drugs and their mechanism of actions. Okay, so let's start our discussion from the term antifungal or antifungi. Okay, coming to the point, antifungal. Anti stands for against, fungal stands for fungi. Those medication which we use to treat fungal infections. In short, if any fungi is going to cause a fungal disease, okay, so in order to treat that disease, we are using some medications. Those medications are actually known as antifungal. And here are the medications, okay, the list of the medications available. Coming to the point, the structure of the fungi with respect to pharmacological targets. Very simple, we have DNA in the fungal structure. We have cell membrane, then cell wall. Now concentrate, this cell wall is different from the cell wall of other organisms, okay, those cells of other organisms, simple. And the cell membrane is also different. Now where are the differences? Let's pin that out. Here we have the cell membrane. Its cell membrane is composed of lipid bilayer. Now you guys might be thinking right now that this lipid bilayer is available in each and every cell membrane, okay. Now, where is the different point? Very simple, just stay calm. This lipid bilayer is having another internal content, that is the ergosterol. Here's the ergosterol. Now, because of this ergosterol, this cell membrane becomes different from the cell membrane of other organisms. Now, a question rises, what is this ergosterol? Very simple. This ergosterol is just like the cholesterol in the animal cell. Got? Now, animals have cholesterol, and here the fungi, they have ergosterol. Now, what is its job? Very simple. It maintains the integrity of the cell membrane. That's it, simple. Now, before we move towards the cell wall, we must know that how this ergosterol is synthesized, because our pharmacology, this pharmacology is going to have a very important role while this ergosterol is synthesized. Means this pharmacology will actually inhibit the synthesis of this ergosterol. So for that, we must know that how this ergosterol is synthesized. During this synthesis phase, there are some points where these drugs are going to act. First, let us know how this is synthesized. Here we have a biomolecule squalene, which is supposed to be having a structure that is known as squalene epoxide, that is being brought by the help of enzyme squalene epoxidase. This enzyme will convert this squalene to squalene epoxide. Then this squalene epoxide will be converted into levonorgestrel. Then by means of another enzyme, 14-alpha sterol demethylase, this levonorgestrel will be converted into ergosterol. Then this ergosterol is available to go and move, to have its space in the cell membrane and to give the integrity, structural support to the cell membrane. Okay, that's it, simple. So this is the way how the ergosterol is synthesized, and then it is doing its job. Okay, come to the next point, that is the cell wall. Now this cell wall has got chitin, proteins, and beta glucan. Now all of these are simple. Chitin is going to have a very important role to provide the chain-like structures. These are actually the two chains considered. Then we have proteins also embedded in them. Along with that, they have beta glucan. Now here we have the chitins. Now these chitins and protein, they are actually somehow dispersed. In order to bring them in a compact structure, these beta glucan will provide a chain-like attachment. Means you can say these are actually chains. Beta glucans are the chains which will hold these proteins and chitins, etc. So like this, a compact structure will be synthesized. Okay, now this beta glucan, it is actually synthesized by means of beta glucan synthase. Okay, now keep this very simple point in your mind, that I'm not going to explain all the things which are going to distract us. Okay, I'm just going to tell you people about the very targets. Okay, that's why I'm coming towards the beta glucan only. Now this beta glucan synthase will actually synthesize the beta glucan. Then this beta glucan is supposed and is responsible to give a compact structure, means to hold the chitin and protein together. That's it, simple. So these are actually the chains, simple. Okay, now let's come towards the next, that is the internal content. We have internally the DNA and microtubules. Okay, again, not going to explain extra stuff. Coming to the point, we have DNA and microtubule. These all are actually the targets considered. Okay, they're going to help us understand the pharmacology in a very easy way. Now we got what? We got how the ergosterol is synthesized by means of these enzymes like squalene epoxidase and 14 alpha steroid demethylase, plus how the cell wall is synthesized by giving the beta glucan chains to the chitin and protein, means how this is actually synthesized totally. And like this we have DNA, which is supposed to have internal content, genetic material, then here the mitochondria, which plays a very important role during the cell division. So you must remember all these points regarding the structure of the fungi. Now these points are going to help us to understand the pharmacology in a very easy way. How? Like, just come to the point. In the pharmacology, we have certain classes, like the very first one, echinocandins, then we have azoles, triazoles, then allylamines, polyenes, grazophilin, and flucytosine. These are actually the drugs and the classes that are going to interact at different points with the cellular structure and to inhibit the growth or to kill this particular fungi. Got two important points: either they inhibit or they kill. You must remember these 2 points regarding the pharmacology and their mechanism of action. The very first class, echinocandins. Echinocandins have got a very interesting point to understand and to memorize these drugs. They all have prefix fungins, like capsofungins and micafungins, etc. We do have some other drugs. Those all have actually these fungins pronunciation. You can pronounce this as well, fungins, okay? Anyway, coming to the point, echinocandins include capsofungins and micafungins. So these are actually the drugs that are included in the echinocandins. So we got now echinocandins class and their identification, then their medication. Now let's know the mechanism of action. First, let's know the site, then the mechanism. The site of action is the cell wall. Where? Cell wall. It is going to disrupt cell wall synthesis. How? Like, these echinocandins are supposed to inhibit beta-glucan synthase enzyme, which was supposed to synthesize beta-glucan, and this beta-glucan was responsible to give a compact structure to hold the protein and chitin together in order to synthesize compact cell wall. So now, if there is no beta-glucan synthase available, there won't be cell wall available, in short, okay? They're actually disrupting cell wall synthesis by means of inhibiting beta-glucan synthase. That's a very simple mechanism of action. Now let's move towards the azoles and triazoles class. In the azoles, we have number of ketocanazoles, azoles, okay? The very first one is ketoconazole, very important and well-known medication. Then we have in the triazoles like itraconazole and some other, okay? Obviously, we have some others in all. So here, I'm going to tell you people about the very specific and very commonly known medications. Coming to the point, the mechanism of action and site of action. These azoles and triazoles, they have got important site of action, that is the cell membrane. And along with that, allylamines, they are also supposed to interact in the synthesis of cell membrane. So azoles and allylamines, they are going to interfere cell membrane synthesis. Now this is actually the site, okay? Now let's move towards the mechanism of action. How? Very simple. Our azoles and triazoles, they are supposed to inhibit a very interesting enzyme, 14 alpha steroid demethylase. If this is inhibited, what will happen then? Then levonorgestrel won't be converted into ergosterol. If this is not synthesized, ergosterol, then we know the integrity of the cell membrane will be lost. So then whatever is present in the cell, that will move out because cell membrane is not available now. So in short, we are going to inhibit the 14 alpha steroid demethylase. When we inhibit this enzyme, then levonorgestrel won't be converted into ergosterol, means we actually inhibited the cell membrane integrity or synthesis, you can say. Along with that, we have allylamines like terbinafines, okay? Now these terbinafines, they've got a very important site, that is squalene epoxidase enzyme. They're going to inhibit squalene epoxidase. Let me write here S for your short at the end when you're taking the screenshot or something else, so it will be very easy for you to understand the mechanism of action in short here. Allylamines like terbinafines, they're going to inhibit which? Squalene epoxidase, SE. When the squalene epoxidase is inhibited, what will happen? Squalene won't be converted into squalene epoxidase. Now, squalene is not going to synthesize squalene epoxide. Then what will happen? Very simple. Then there won't be synthesis of ergosterol at the end. So you can say then won't be the synthesis of the cell membrane at the end. Okay. So like this, azoles and triazoles, they collectively are supposed to interact. Azoles, triazoles, allylamines. Where? In the cell membrane synthesis. Cell wall we have echinocandins, and for cell membrane we have azoles, triazoles, and allylamines. The next one is polyene. Poly means several ene double bonds. So now these like amphotericin B and trichomycin, they've got a long double bond structure in their chemical structure. Okay. Now amphotericin B and trichomycin, they are supposed to produce or synthesize channels where here. Where there is actually this ergosterol available. Where there is ergosterol, there it will introduce channels. Okay. Now these channels synthesized by the polyenes are responsible to allow the content present inside the cell membrane that will start moving out, specifically that is potassium ions. They will start moving out. So in short, the polyenes are responsible to introduce channels in the cell membrane by means of which the internal content will start moving out. This is the mechanism of action of polyenes. And here we have the number 5, that is grazofulvin, and then we have flucytosine. Now grazofulvin is responsible to inhibit the microtubules. That right here M. Microtubules are supposed to be inhibited by grazofulvins. Okay, and we know when there is no microtubule available, then there is no cell division. And here we have flucytosine. Now what is its site? DNA. It's going to disrupt the DNA synthesis. Simple. So I guess we completed the entire pharmacology. I hope you got. If still you have a confusion anywhere, drop in the comment box. Thank you for watching.